Hi, let's talk about the second most common thing that we see in the practice, called neuromas. Neuromas are inflamed nerve tissue in between the toes. Common symptoms include burning in the toes between the second and third toe or between the third and fourth toes, feeling like you're walking on a pebble or rock, or burning sensation on the ball of the foot. This can be very debilitating for people, especially if you like to wear high heels or very narrow shoes. This can cause more aggravation of this tissue. So let's go on with the 5 secrets of neuromas that your doctor may not tell you. Number 1, over 50% of people who have had neuroma surgery are either unhappy or suffer a recurrence of neuromas in the foot. Number 2, repeated strong steroid injections can help to thin the fat pad on the ball of the foot, which could be counterproductive to what you want. Number 3, physical therapy and orthotic therapy can be successful for up to 85% of patients. Number 4, multiple neuromas on the bottom of the foot can signify a compression of the nerve around the inside of the ankle. Number 5, tight shoes and walking barefoot tends to be the leading cause of neuromas. So let's talk about point number 1. Over 50% of patients are unhappy with the surgery, either due to recurrence or just continued pain or worsening of pain from surgery. It doesn't matter how good your surgeon is, unfortunately, this does happen. Nerve tissue is a live tissue, and unfortunately no one can predict the recurrence of neuroma surgery. There is a technique where the surgeon can bury the stump of the nerve into a muscle or a joint capsule as an additional procedure to prevent this recurrence, but it's not 100% guaranteed. Number 2, the strong injection unfortunately can cause thinning of the fat pad on the bottom of the foot, which is where patients feel most of the pain. The bottom of the foot being right about here, this is the general area where patients feel pain. They feel like they're walking on a rock, walking on a pebble, or feels like there is something that they're stepping on, or a rolled up sock in the crest or the what we call the sulcus, or the bend of the toes. So we definitely don't want this fat pad to go away. This is our body's natural cushion. So too many corticosteroid injection into that area can cause thinning of this fat pad. Physical therapy modalities can definitely help. Your podiatrist should order some physical therapy to see if that will help you out. Most of our patients actually feel really good with physical therapy, electrical stimulation, or ultrasound stimulation to help decrease the inflammation of the nerve. Now, tight shoes, how does that cause that problem? Let's say you have the neuromas are in between the toes, right about here. They run in between these bones, the metatarsal. These are the metatarsals, the long bone, 2, 3, 4, 5. Most common is in this space and this space. So if you can imagine, the poor nerve is exaggerating now. If it grows big, sometimes you'll actually see the second and third toe splay apart like this in a patient. Sometimes you see a person with this, that means the neuroma is pretty big. So imagine a big growth of nerve in between there. So again, this is exaggeration, but if you wear shoes that are too tight and narrow, can you imagine pressing together from the side and causing this nerve to be compressed or pushed together? This can exacerbate symptoms, and that's one of the ways we test for neuromas. So when your doctor squeezes and a nerve pops from the bottom to the top, the doctor can feel that. That's very indicative of a neuroma deformity, as well as displaying of the second and third toe, as an exaggeration here, that is caused by the inflammation of that neuroma. So what do we do conservatively to avoid this surgical 50% chance of recurrence and continued pain? Well, definitely surgery is not the first line of defense for neuromas. Basically, we have high energy shockwave therapy. We also have something called radiofrequency ablation that's used for cancer cells and used for treatment of other benign growth around the body and the nerve around the neck and the back. Now we're using it in the foot. Basically, we stick a probe in the office after local anesthesia from top to bottom. We hit the nerve, and pretty much it shrinks that nerve. We do it for 90 seconds times 2 times. There's actually a video on that on the website neuromasecrets.com. Again, it's neuromasecrets.com. There is a video about radiofrequency ablation. Another good option is alcohol injection. Various preparation of alcohol injection have been used for neuromas that can actually help to ablate or actually shrink the symptomatic neuroma. Typically 4% alcohol solution mixed with another variable solution that your physician decides to use. That is a series of 8 to 10 injections once a week to help to kill the nerve without surgery. Again, all these options are conservative options for neuromas before undergoing a surgical excision, which has questionable results. It does not depend on your surgeon skill. It is unfortunately one of those surgeries that does not have a very high success rate regardless of technique. So hopefully this will give you some education about neuromas. And if there's any questions, please visit our website at www.naples.podiatrist.com or www.neuromasecrets.com specifically about neuromas.